Bronchiolitis is a viral infection that affects more than 450,000 infants each year. What are the symptoms of this respiratory disease? How to treat it? Bronchiolitis is a highly contagious viral disease that affects approximately 30% of infants under the age of 2 each winter, half of infected children under 6 months of age. Boys make up about 60% of babies with bronchiolitis. It is an acute inflammation of the bronchioles, small bronchi, which often progresses to respiratory distress. The respiratory syncytial virus, RSV, is the leading infectious agent of this disease. Bronchiolitis is a typical winter infection. It begins around mid-October and ends in February. A peak is often recorded in December. Symptoms of bronchiolitis. The bronchiolitis may start with a cold which worsens rapidly with signs of difficulty breathing. Baby hardly drinks his milk. A dry cough sets in and becomes increasingly fatty, which causes significant congestion and respiratory discomfort. The cough can last for 2 to 3 weeks. The child has wheezing, a fever moderate, a fatigue or exhaustion. In children under 1 year old, with a brand new immune system, this virus can invade the respiratory tracts deep down to the small bronchi, and cause respiratory discomfort that must be taken seriously, explains Dr. Sebin, pediatrician and coordinator of the Bronchiolitis Île-de-France network. When the first symptoms are announced, it is recommended to consult a doctor as soon as possible. The sooner your child is taken care of, the more likely he or she will be treated at home. 95% of babies with bronchiolitis will not go to the hospital. What are the treatments for bronchiolitis? On the treatment side, corticosteroids and bronchodilators are useless, explains Dr. Sebin. No more than antibiotics, except in cases of superinfection. And we must banish cough suppressants and bronchial thinners. Cough is a symptom that must be respected, especially in the context of bronchiolitis. Since November 2019, the HAS, Haute Autorité de Santé, advises against traditional respiratory physiotherapy techniques such as clapping or vibration, for example. The technique of increased expiratory flow, AFE, is not effective in the management of infants hospitalized with acute bronchiolitis. As it has not been proven effective for forms of bronchiolitis treated on an outpatient basis either, it is therefore not recommended. However, the HAS and the CNPP stress the need to continue research and conduct studies to measure the impact of this technique, in particular on the use of hospitalizations. Treatment is mainly based on washing the nose and keeping the child under close supervision. It is a painless gesture which consists of instilling serum into the nostrils to evacuate nasal secretions. Objective: to optimize the infant's breathing and relieve it. In most cases, bronchiolitis heals in about 5 to 10 days. Baby has bronchiolitis. The right actions to adopt: here are some simple tips to relieve your baby, help him breathe better, and avoid contagion with other children. Regularly ventilate the baby's room. Do not overheat it. Do not smoke in the presence of your baby and do not take him to smoky places. Continue to lay your baby on his back, and put a cushion under the mattress to tilt him slightly. Give him a drink regularly. Split his meals. Wash your nose with physiological serum, several times a day, preferably before meals. Make sure your baby is feeding properly and taking his bottles properly. Monitor his breathing, temperature and absence of diarrhea. Wash hands with soap before and after treatment. Do not drop off your baby at the creche before the end of the demonstrations. How to avoid bronchiolitis? Bronchiolitis can be transmitted directly, from person to person, sneezing, coughing, etc. or by contact with an object soiled by the virus, on a toy, pacifier, soft toy, etc. Here are some simple things you can do to avoid putting your baby in contact with the respiratory syncytial virus, RSV, which is responsible for the infection. Do not kiss your baby when you have nasopharyngitis or bronchitis, and wear a mask when taking care of him. Ask his brothers, sisters and members of the entourage to avoid kissing him. Clean your nose regularly with physiological serum. Use disposable tissues. Do not take your child to places where there is a risk of coming into contact with people suffering from infectious diseases, public transport, supermarkets, although hand washing with soap before dealing him.